Why does rubbing on the painful side help with pain relief?
You know that moment when you bump your knee against a table corner and the first thing you do is rub it? Almost like magic, the sharp pain seems to fade a bit. There's actually some fascinating science behind this instinctive response that we all share. What you're experiencing is something called the pain gate mechanism, and understanding it can change how you think about pain itself. This isn't just academic curiosity, Akshay. This knowledge affects how doctors treat patients, how physiotherapists design recovery programs, and even how you might handle everyday aches and injuries at home. Here's how it works. Your nervous system is like a busy highway with different lanes for different types of information. When you get injured, pain signals travel through thin, slow nerve fibers to your spinal cord and then up to your brain. But here's the interesting part. Touch and pressure sensations travel through thicker, faster nerve fibers along the same route. Think of your spinal cord as having a gate. When those faster touch signals reach the gate first, they essentially crowd out the slower pain signals. It's like a traffic jam where the faster cars get through while the slower ones get stuck behind. This is why rubbing that bumped knee actually works. You're flooding the system with touch sensations that compete with and partially block the pain messages. The brilliant thing is that this mechanism exists to protect us. In the wild, if our ancestors got injured while being chased by a predator, their survival depended on being able to keep moving despite the pain. The gate mechanism allowed urgent touch and movement signals to override pain temporarily. Now, different people frame this discovery differently. Medical professionals see it as validation for hands-on treatments like massage and physiotherapy. Some alternative medicine practitioners use it to justify various touch-based therapies, but here's where we need to be careful. While the gate mechanism is real and scientifically proven, it doesn't mean that all touch-based therapies are equally effective or that they can replace proper medical care for serious conditions. There's a common myth that pain is just in your head or that you can simply think it away. The gate mechanism shows us that pain is much more complex than that. It's not just psychological, but it's also not purely physical. Your nervous system is constantly processing and filtering information, and understanding this can help you make better decisions about pain management. The pain gate mechanism reveals that our bodies have built-in systems for managing discomfort, and sometimes the simplest responses like rubbing or gentle pressure can genuinely help. Next time you instinctively reach to soothe a minor injury, remember that you're actually engaging with millions of years of evolutionary wisdom about how our nervous systems work.